Hello my cosmetic friends out there. I've got a question from our Facebook page from Michelle Hart. She asks us, how do you have Botox in your forehead but not feel heavy in the eyebrows or eyelids? Firstly, this is a common problem we have on a daily basis here. A problem because the forehead muscle called the frontalis actually elevates the eyebrows and the eyelids. And it's the only elevator of the eyebrows and eyelids. There's nothing else which elevates it. There's no other muscle in the face. Just one muscle called the frontalis. It's got two bellies which attach to just under the brow, and they lifts up your forehead. Yes, it's a good thing to lift up your forehead. The problem with this is that when you lift up your forehead, you get wrinkles. People hate having wrinkles in their forehead. It gives them a worried appearance. It's something that people want to get rid of. Botox is often used in the forehead to stop elevation of the eyebrows and eyelids. So what actually happens is that it flattens the whole forehead and wrinkles become less. But as a result of the frontalis muscle, the forehead muscle being the only elevator of the brows, what people often find is that it gives you a bit of a drop. Clinicians have to make a compromise with how much Botox we put in the forehead, because too much Botox in the forehead could cause heaviness in the eyebrows, and too little can cause too much movement or wrinkling of the forehead. The first thing I often do with my patients is assess how their brow position is. So like for myself, I've got a lot of skin there which is sort of genetic in my case, and if I have even a small amount of Botox in my forehead, it really does give me a heavy feeling, and I really don't like that. So those people with forehead lines or a lot of movement in their forehead, they'll really want to treat it. So how do we come to some sort of balance and compromise? First thing is working out the dose. So generally we start low with the dosage. It might be, you might start at say half a normal dose if someone has heavy eyelids. After assessing their eyelids, put in a small dose, and that can help. It doesn't always get rid of the forehead lines completely or the movement completely, but sometimes that's not a bad thing. Looking natural can be a good thing. The other thing that I often see, which I don't agree with, is that practitioners will inject just the center part of the forehead. So basically the Botox will hold the center part of the forehead still, and the outer parts of the forehead will still raise. So you get this, what I call Dr. Spock look. So you get this elevation like this because we've just paralyzed the center part of the forehead, but the outer parts of the forehead we've left. Look, it does help with the compromise between the heaviness and reducing wrinkles, but what the end result is that you get this, I think it looks terribly unnatural and doesn't look, and it's a giveaway for that you've had Botox done. So you get this elevation of the eyebrow at the ends, at the tails of the eyebrow, and also you get wrinkles just above there. So you get a wrinkle just above your lateral tail of the eyebrow, and that looks unusual. And generally speaking, you know, the brows are not meant to be super arched like that. Look at a young girl, for example. Her brows are generally full and fairly low. They're not arched like this. Actually, in fact, as we get older, sometimes our brain tells us to lift our eyebrows higher and higher and higher. So as we get older, our brows tend to get higher, ironically. One of the few parts of the face which goes up with time. People generally come in, I would say probably 9 out of 10 women who come in ask me for an eyebrow lift. Now once again, this is not necessarily something that looks good and not necessarily something that looks youthful. So as we age, sometimes remember our brows go up to compensate for excessive eyelid skin. So our brain tells us to lift our eyelids up, our eyebrows up. So aesthetically, a fairly low, flat brow, which is full, is the most aesthetically pleasing. It can go a bit beyond that, where you have excessive skin here as well. Now in that case, what needs to be done usually is a surgical blepharoplasty. So if you're finding that you have too much skin here and and you're wanting to compensate by using Botox or some other method to give you a brow lift, it's probably best that you go and get a little bit of skin excised from your upper eyelid. You don't need to lift the brows up like this so that your eyelids look lighter. It's sometimes necessary to have surgery in this case. Usually we assess this by looking at where the eyelid sits, and if your eyelid sits on your eyelashes, so the eyelid is sitting on eyelashes, then you are a candidate for surgical blepharoplasty or eyelid reduction. One other little trick we can do, which doesn't give you the Dr. Spock or the super arched eyebrows, and that is to put a little bit of Botox in the depressor of the brow, which is the orbicularis muscle. So this is a sphincter muscle which basically shuts the eyes and pulls the brows down like this. So you can see my brow is dropping. So what I can do is put a little bit of Botox in here and here with the forehead Botox. So I'm stopping the pulling down force of the orbicularis oculi muscle, which is just there. So putting a drop of Botox in there when we do forehead Botox is also very, very effective in helping reduce the depressing effect of forehead Botox. The irony of all this is also this. People who have more forehead lines or have resting muscle tension, that is, when they're even not trying to raise their forehead, they're raising their forehead, and they've got wrinkles all the time. These are the hardest people to treat, and probably the most likely people to come in for a treatment like Botox. So this is the irony behind that. The more heavy we get in the upper eyelid, the more our brain tells us to elevate our brows and activate that frontalis muscle. So what ends up happening is that you get stuck. It gets stuck there literally. So you get hypertonicity, or sort of constant activation of that frontalis muscle, the forehead muscle. So it sticks there, and as a result, your muscle tension is always on. Your muscle's always on, and as a result, you get forehead lines which are permanently etched in. Now, these people actually make very poor candidates for having Botox, because as soon as you touch them with any Botox, they're going to feel awfully heavy. So this is the irony. People with the most forehead wrinkles are often the least suited to Botox treatments in the forehead. So how can we overcome this problem? So how do we treat the forehead lines without causing too much drop of the brow? Well, this could be the answer for a lot of you out there, and the answer is dermal fillers. So interestingly, what you can do is treat the forehead with dermal fillers instead of Botox. So often as we get older, our face loses volume, so we shrink and shrivel, especially if you exercise or if you're very lean or fit. And what happens is you get a concavity just above your brow. So a bit of a concavity there. And this is something we see quite a lot. So the forehead generally loses a lot of volume. And if you think about it, losing volume in the forehead is like taking a beach ball and taking a little bit of air out of it. It's going to sag and sink. So with loss of forehead volume, you do get a little bit of brow droop. Okay, so putting the volume back in the forehead is a very effective means of lifting or of repositioning the brows. So dermal fillers in the forehead is effective because it replaces volume, which lifts the brow a little bit, and importantly as well, it also helps to efface or reduce forehead wrinkles because you're adding volume to an area which is shrunken. So if something's shrunk, then it will naturally wrinkle more. The other thing you can do with dermal fillers is then use them to fill the lines very superficially. So you can use a finer dermal filler, for example, in the skin, not deep like I was explaining before to revolumize, but just in a dermal filler in the skin, in through those lines, and that will also give you a very, very nice smooth appearance to the forehead. So in summary, the question to how do we do Botox in the forehead without giving you a heavy brow or heavy eyelid is by looking at the dosage, looking at reducing the activity of opposing muscles, orbicularis oculi, which pulls down, so knocking that out a bit. Looking at using fillers to revolumize the face or revolumize the forehead, as well as to fill in fine lines, and also to look sometimes at having a little bit of surgery just to take out the excess skin in the upper eyelid prior to having any Botox. So I hope that's helped answer the question. I look forward to answering your questions in the future.